If I exercise, it will make it worse. Has that thought ever crossed your mind? Maybe more than once. Maybe every time someone suggests you move more, go for a walk, do some exercise, and you smile, agree, but deep down, you know that the last time you tried, your knee made you pay for it. And it's not in your head, it's experience. You tried, it hurt, and you learned to associate movement with pain. So your body started asking for less, and you started giving less. It makes perfect sense. That's how our body's natural protection works. But here's the problem. Your knee needs movement to recover. It needs strength to stop hurting. And when we stop completely, thinking we're protecting it, we're actually feeding the cycle that keeps the pain alive. I know it sounds contradictory, and that's exactly why I'm here today. I'm a physiotherapist with over 10 years of clinical experience, and this video is for a very specific person. Someone who wants to take care of themselves but is afraid of making things worse. Someone who has already given up on exercise because of pain. Someone who needs a safe, realistic starting point that respects where they are right now. Today I've brought you 6 exercises you can do sitting down, in your chair at home, no impact, nothing that demands more from your knee than it can handle right now. From number 6 to number 1, the most important of all. And stay until the end, because in the bonus, I'll reveal the best aerobic exercise for people with knee pain. Because walking might not be the best answer. Let me quickly explain what might be happening to you. Not just in your knee, but in your mind as well. There are many causes of knee pain. But for people who are 50, 60, or older, the main cause is rarely what most people think. It's not necessarily a serious injury, nor simply the wear and tear that shows up on an X-ray. The most common cause in this age group is muscle loss. After 50, the body starts losing muscle progressively, and when the muscles around the knee weaken, the joint starts taking on a load it shouldn't carry alone. Every step, every time you sit or stand, that impact builds up. And then the pain shows up. There's a statistic that still impresses me in the clinic. People with knee pain have, on average, 24% less quadriceps strength than healthy people of the same age. That's exactly the muscle that protects your knee in everyday movements. And what happens when pain shows up? There's a clinical name for it, kinesiophobia. It's an excessive fear of movement, based on the belief that it will cause pain or worsen the injury, and it limits mobility and daily function. You tried, it hurt, and you learned to associate movement with pain. It makes perfect sense. But there's a cost. Avoiding activity because of pain leads to muscle weakness. And that weakness further increases physical limitations. The cycle goes like this. Muscle loss leads to overload. Overload leads to pain. Pain leads to fear. Fear leads to less movement. Less movement leads to more weakness, and more weakness leads to more pain. The way out isn't to push through. It's to recognize where you are and start from there. Safely, with control, without impact. Tell me in the comments, have you ever stopped doing something you enjoy because of knee pain? Type yes or no. I read and reply to every comment. That helps me create more videos that can help you. Before we start, let's agree on something. Mild muscle discomfort can happen. It's a sign the muscle is working. But sharp knee pain should not. If at any point you feel strong pain, stop and rest. And if needed, move on to the next exercise. Now let's go to number 6. Exercise 6, seated ankle pump. I know, you might be thinking. Ankle pumping is going to help my knee? It will, and I'll explain why I'm starting with this one. When pain is present, circulation in the area slows down and the fluid that lubricates the knee doesn't distribute properly. It's like trying to open a rusty door without oil on the hinges. This exercise fixes exactly that. It warms up, lubricates, prepares, with zero load on the knee. To do it, sit comfortably in a chair with your feet flat on the floor. Keep your spine upright, hands relaxed on your thighs. Now, slowly pull your toes toward you. Feel your calf working. Hold for a second. Then point your feet downward as if trying to touch the floor with your toes. Hold for another second, and return. The movement is slow and controlled, almost like you're pressing an imaginary pedal. 2 common mistakes: going too fast and holding your breath. Breathe normally throughout the movement. Do 2 sets of 20 repetitions with 30 seconds of rest between them. Now let's move on to number 5. This one will work on something pain quietly takes away from your knee. Exercise 5. Seated march. This one looks simple, and it is. But don't be fooled by its simplicity, because it's doing more than it seems. Seated marching activates the hip flexor muscle that lifts the leg, the iliopsoas, and at the same time forces the core and trunk stabilizers to work together. For the knee, this matters because a weak hip transfers load downward, straight to the joint. Strengthening this entire chain while seated, without impact, is exactly what we need at this stage. To do it, sit upright with your spine straight, feet flat on the floor at hip width, hands relaxed on your thighs, or lightly holding the sides of the chair if you need support. As you exhale, lift one knee toward your chest, slowly, with control, only as far as is comfortable, without forcing it. Hold this position for 1 second, feeling the front of your hip working. Then lower your foot back to the ground with control. Don't let it drop. As soon as your foot touches the floor, begin lifting the other side. The rhythm is steady, like a slow walk, alternating from one side to the other. The secret is in the descent. Lowering with control is already muscle work. Don't just drop your foot to the floor. 2 common mistakes: leaning your torso backward when lifting the knee and moving too fast, losing control. Do 2 sets of 20 alternating repetitions with 30 seconds of rest between them. Exercise 4. Adduction with a pillow. Squeeze. Grab a pillow. It can be the one from your couch or a cushion. This exercise will activate a muscle on the inner thigh that has a direct connection to knee stability, the adductor. To do it, sit upright with your spine straight, feet flat on the floor at hip width. Place the pillow between your knees, well positioned in the middle, not too far forward or backward. Now squeeze the pillow with both knees at the same time, as if you're trying to flatten it. Squeeze firmly, hold for 5 seconds, and release slowly. This is not a quick movement. It's a sustained contraction. Feel the inner thigh muscles working. If you place your hand there, you'll feel the muscle tighten. The secret is to keep your spine upright during the contraction. Many people, without noticing, lean forward when squeezing. That takes the focus away from the correct muscle. 2 common mistakes: squeezing only with the knees without engaging the inner thigh, and releasing all at once instead of with control. Do 2 sets of 12 repetitions, holding for 5 seconds each, with 30 seconds of rest between them. Exercise 3. Abduction with elastic band. Now we're going to use a resistance band. If you don't have one at home, it's definitely worth getting. It's inexpensive, easy to find, and will show up in several exercises from here on. This exercise targets the gluteus medius, the muscle on the side of the hip. It's the knee's guardian. When it's strong, it keeps the knee aligned during every step, every time you go downstairs, every time you stand up from a chair. When it's weak, the knee starts to cave inward, and that's when pain shows up. To do it, place the resistance band around your thighs, just above the knees. Sit upright with your spine straight, feet flat on the floor at hip width. Now, slowly push one knee outward, as if you're trying to stretch the band. Go only as far as you can without leaning your torso. Hold for 2 seconds in that position, feeling the side of your hip engage. Then bring the knee back with control. Don't let the band pull it back on its own. Perform the movement on one side, complete the repetitions, then switch to the other side. The secret is not letting the band win. The return has to be just as controlled as the push. That's where the muscle really works. Do 2 sets of 15 repetitions on each side with 30 seconds of rest between them. Exercise 2. Seated eccentric knee extension. Now we reach the quadriceps strengthening exercise. And this one has a key detail that makes all the difference. The focus is on the lowering phase, not the lifting. Let me explain. There are 2 types of muscle contraction. The normal contraction, when the muscle shortens to move the limb, and the eccentric contraction when the muscle works while lengthening, meaning during the deceleration phase of movement. This second type is the most powerful for strengthening the quadriceps and at the same time the most protective for the knee. That's exactly what we're doing here. To do it, sit upright with your spine straight, feet flat on the floor. Now slowly extend one leg. Straighten your knee as far as you can without pain, without locking it. Hold for 2 seconds with the leg extended, feeling your thigh engage. Now comes the most important part. Lower the leg back down, counting 4 seconds. Slowly, with full control. 4 seconds to lower. As soon as your foot touches the ground, begin lifting again. Complete all repetitions on one side, then switch to the other. The secret is in the 4-second descent. It's not a random number. It's the time needed for the muscle to truly work during the eccentric phase. If you lower too fast, you lose the main benefit of the exercise. 2 common mistakes: locking the knee completely at the top of the movement and rushing the descent. Start with 2 sets of 12 repetitions on each leg. Over time, when this movement becomes easy and you feel your leg getting stronger, you can progress by adding a resistance band just above the ankle. It will add light resistance and take the exercise to the next level without sacrificing safety. Now let's move on to number 1, the most important exercise in the entire video. And I guarantee you already do it every day without even noticing. Exercise 1. Sit to stand. Of all the movements your knee needs to perform daily, this is the most demanded. Getting out of bed in the morning, getting out of the car, standing up from the toilet. You do this movement dozens of times a day. And if it hurts, everything in life becomes harder. The good news is that training this movement is the most direct way to improve exactly what's bothering you in real life. This isn't a gym exercise. It's life turned into training. To do it, sit at the edge of a chair with your feet flat on the floor at hip width. Keep your spine upright, hands on your thighs or crossed over your chest. Now lean your torso slightly forward, as if you're about to hug someone in front of you, and push the ground with both feet to stand up. Rise slowly, without rushing. Once you're standing, stay steady for 1 second. Then, the most important part, lower yourself back down to the chair with control, slowly, as if you're landing. Don't drop into the chair, land. 4 seconds to go down. Now, if pain is still present, I have 2 adjustments that can make a big difference. First, place a cushion on the chair before sitting. This makes the chair higher, reduces the range of motion, and takes some load off the knee, making the exercise much more accessible. Second, place a resistance band just above your knees during the movement. It seems simple, but the band automatically activates the gluteus medius. And when that muscle kicks in, it unloads the knee, and many people feel immediate pain relief. Worth trying. The secret is in the landing. The controlled descent is where the quadriceps truly get stronger. It's exactly this control that will make the difference on stairs, in bed, in the car. 2 common mistakes: using your arms to push yourself off the chair, which takes the work away from your legs, and dropping back into the chair instead of lowering with control. Do 2 sets of 10 repetitions, with 45 seconds of rest between them. If you need to hold on to the chair to feel safe, that's fine. Gradually reduce the support as your confidence grows. Remember our agreement. Mild muscle discomfort can happen. Sharp knee pain should not. Now that we've made it this far, let me be direct with you about how to use these exercises. 3 times per week, on alternate days. That's all you need. You don't have to do it every day, and you don't need to spend an hour on it. Muscles need stimulus, but they also need time to adapt. It's during the rest between sessions that strength is actually built. The first week will feel strange. New movements always do. You might feel like you're doing it wrong, that it's too easy, that it's not working. Keep going. Your body is learning to move in a way that protects your knee, and that learning takes a few days to settle in. From the second week on, you'll start noticing the difference, not necessarily during the workout, but outside of it. A chair that used to require effort to stand up from starts to feel easier. A stretch you used to walk carefully through starts to flow better. Small details, but those are exactly the signs that the work is paying off. And if one day you can't do everything, do what you can. Deal? 2 exercises are better than 0. What breaks progress isn't a bad day. It's quitting after it. I promised at the beginning of the video to talk about the best aerobic exercise for people with knee pain. And it's a topic that raises a lot of questions in the clinic. When knee pain shows up, the first thing most people do is stop everything. No walking, no cycling, nothing. And then they wait for it to get better. But the body doesn't work like that. It needs movement to recover. The key is choosing the right movement. Walking is the most natural aerobic activity in the world. But for someone with knee pain, it might not be the best choice right now, especially on uneven ground, downhill paths, or long distances. Each step while walking places a load equivalent to about 1.5 times your body weight on the knee. When the muscles are still weak, that load builds up quickly. So what's the best option? Cycling, preferably a stationary bike. And the reason is simple. The pedaling motion keeps the knee moving, improves circulation, strengthens the quadriceps and glutes, all without impact. The knee bends and straightens in a smooth, circular motion without tammeling body weight with each repetition. If you don't have a bike at home, walking in water, in a shallow pool, is another excellent option. The water reduces impact by up to 70%, allowing you to move much more comfortably. And regular walking? You don't have to give it up forever. But for now, while your knee is still weak, prioritize cycling or water-based exercise. As your muscle strength returns, and it will return with these exercises, walking will come back too, with much more comfort. I need to tell you something important. The exercises in this video were designed for people who have knee pain related to muscle weakness, which, as I explained at the beginning, is the most common cause after 60. But if your pain is very intense, getting worse over time, or comes with significant swelling, locking, or a feeling of instability, the best option is to consult a doctor or physiotherapist for an individualized assessment. Every body is different, and some situations need a closer look. Now tell me in the comments, how old are you, and where are you watching from? I read some responses whenever I can, and they help me understand what you need most. And if you want to keep taking care of your body with simple, safe exercises designed for real life after 60, subscribe to the channel. There's a lot more content coming your way. I left 2 options in the pinned comment that can help you on this journey. The first is a complete exercise program, organized step by step, for you to follow at home at your own pace. The second is a natural supplement specifically developed for joint health and to help reduce inflammation. The links are there. See you in the next video.